Hello, my name is Lindsay, and I'm going to be doing a head, eye, ear, nose, and throat exam on my patient Nico Shasha, also a musculoskeletal and a neurological exam. As I see, my patient is alert and oriented. He is upright, he has good posture. I watched him walk in, he had a good gait, good mobility. He's a good and normal range of motion of his joints, no involuntary movements. He has a happy and normal mood. He has no physical deformities. He has a regular speech pattern. It's clear, precise, he understands, and his hearing is normal. He doesn't ask me to repeat anything or doesn't understand what I'm saying. So I'm going to be doing a musculoskeletal exam on you. I'm first going to assess your spine, so can you stand up? All right, put your chin to your chest. Bend your chin to your chest. I'm going to be palpating the spinal processes in the neck all the way down to the C7. I can feel that it's straight. Okay, you can sit down. Put your chin back to your chest. Look up to the ceiling. Look to your left side, to your right side. All right. Now put your right ear to your shoulder, left ear to your left shoulder. All right. Now I'm going to put my hand here. You can put your head back straight. I'm going to put my hand here. Turn towards me against my force. Good job. All right, now this way. Good job. All right, good job. All right, now you can stand up. I'm going to do a shoulder assessment. So I'm going to go behind you. I'm going to press my hands on your shoulders and lift them up. Good job. All right. Now I'm going to have you lift your arms all the way to the top of your head. Okay, so now lift your arms straight up above your head. Now back down, out to the sides, back down. All right. Now I'm also going to palpate the shoulders and the elbows for anything abnormal, any tenderness, lumps. He does not have any of those. Now you can take a seat. All right. Bend your elbows. Bend them.
Okay.
Make them straight. All right. I'm going to check the strength of his elbows now. So you're gonna push against me. Ready? Push this arm out. All right. Push this arm back in. Nope, this arm. Push it back in. There you go. Push this arm in. Good job. Now push it out and try using just your arm. There you go. Okay. Now I'm going to move his wrists around. Go like this. Move them around. Checking for mobility. Make sure you can move them all. I'm now going to palpate down the hands and the fingers to make sure there's no abnormalities, lumps, tenderness, all that stuff again. All right. Now I'm going to check his epitrochlear nodes in his arm, which are under here. They're usually non-palpable. If they are palpable, that means it's an infection disease. Could be something with inflammation. So now I'm going to do a motor function, which includes coordination. So I'm going to start with him standing up. All right, you're going to walk to the phone and back. As he's walking to the phone and back, I'm watching his gait and his stance, which appear normal and appropriate. Also, his posture is good, and he has no abnormal tics. Now I'm going to look for his muscles for atrophy, and I'll start with the biceps, triceps, forearms, thighs, and legs. So you can sit down. So now I'm going to move your arms. I'm lifting them up and stuff. Looking for rigid and spasmatic, but they're good. All right, now I'm going to test the muscle strength and the range of motion of his joints. So I'm going to start with his hand. So I'm going to push your hands together. Try pulling them apart. Ready? Go. Good. Now I'm going to push them out. Try pulling them in. Good. All right. I'm going to push them down. Try pulling them up. Good. Now I'm going to push them down. You pull, or I'm going to push them up. You pull down. Good job. All right. Now I'm going to try to test his strength in his elbows. So I'm going to push down on them again. So lift your elbow up. So I'm going to push down. You're going to lift up. Ready? Go. There you go. Use one hand. Ready? I'm going to push up. You push down. There you go. Other side. I'm going to push up. You push down. There you go. I'm going to push down. You're going to push up. Good job. All right. Now put your shoulders at your sides with your elbows bent like this. And now try to push out against me. Push them outside. There you go. Now you're going to push them inside. Push them closer to you. Ready? There you go. All right. And then now I'm going to move on to his lower extremities. The lower legs are symmetric. The hair distribution is normal. And he has no skin abnormalities such as lesions, but he does have scars on his knees. So his skin temperature is warm. There's no edema present. Popliteal pulse. I'm setting my timer. I'm going to do it for 30 seconds, multiply it by 2. Okay. Relax your leg. Gotta find it. right, so it's 41 for 30 seconds, so it's 82 beats per minute. Now I'm gonna go ahead and check his posterior tibial pulse, which is down here. Bend your knee a little bit. It was 40 for 30 seconds, so that's 80 beats per minute. And now I'm gonna do his dorsalis pedis pulse for 30 seconds, which is over the top of the foot.
This.
All right, and then that was also 40 beats for 30 seconds, so it's 80 beats per minute. All right, now I'm gonna do his muscle strength and range of motion. I'm gonna start with his hips, so I'm gonna have you lay down. Lay down on the couch.
Okay.
All right, so I'm gonna palpate his hips first for any tenderness. Do you have any tenderness, any pain?
No.
Doesn't hurt? All right. Now I'm gonna start with bending your knee. So I'm gonna bend your knee, just one knee, ready? All right, push up against my hand. Good job. Push against my hand. All right, lift it up.
This is
Up and
like
down.
going down.
Ready? Push it out, over, push against my hand, out that way. There you go. Pull, push that way against my hand. Perfect. Other knee. Lift up your knee. Ready? Push down. There you go. Now, you're strong. Now push up. There you go. Push out. There you go. Push in. Good job. You can relax your legs. All right. Now I'm going to do his feet. I'm going to palpate all the bones of his feet. Make sure there's no abnormalities. Same with his ankles. All right. So push against my hands. Perfect. Push towards my hands. Good. Keep your legs straight. Push outward. Like outside. There you go. Now push inside. Good job. All right. Now I'm going to do his spine. So I'm going to have you stand up.
What's the spine?
Your spine is this. It's your spine is processed down your back. So I'm going to have you bend your toes. Bend down, touch your toes.
Okay.
All right. Now I'm just going to feel the spine nice and straight. There's the curvature when they bend. It's like a C cup. All right. You can stand up. All right. Put hands on your hips. Bend side to side to the right. This is all range of motion of your spine. Now bend forward. Bend forward.
Okay.
With your hands on your hips. And bend backwards. There you go. Perfect. You can sit down. Now it's our head, eye, ear, nose, and throat examination. So I'm going to start with his head and then move all the way down to his neck. I'm going to start with your head exam by inspecting your hair distribution, which is normal. No signs of hair loss. All normal. And then I'm going to find the shape and the contour of his cranium, which seems to be normal. There's no abnormalities. It is your head. Good job. All right. And then I will be palpating his scalp and skull, feeling for any lumps or bumps, and I'm also feeling for depressions, but feeling it.
My patella is.
Your patella is right here.
I know.
Yeah. There's no bumps, no tenderness, no lumps, no depressions in his head.
I thought this was a bump right here.
Where?
Right here.
No, that's your skull.
Okay.
All right. I will also feel for the normal occiput, which is back here. This is back, right in the back of the head, right here, which is normal. And now I'm going to move to the face. So I will now inspect his face for symmetry, any involuntary facial movements, scarring, or lesions. He has no scarring, no lesions, symmetric. You don't want that stuff.
Scars.
Now I'll feel for your temporal pulse, which is right down here. And I'm going to take it. I'm going to count for 30 seconds, multiplied by 2. Hold on, I need my thing. All right. You want to do it with me? Ready? Set, go. 30, so it's 60 beats per minute. All right. Now I'm gonna feel for your temporal pulse, which is up here, up here, right here. Now I'm gonna feel for the temporal artery, down to the temporal mandibular joint. Right, open your mouth, close your mouth, open, close. I'm doing that to feel for any clicking. Right. Now I'm gonna palpate your sinuses starting with the frontal maxillary, feeling for any pressure or pain, okay? So look at me. Feel any pressure or pain?
No.
No? No pain in here? Okay. All right. Now for the eyes. I'm always gonna start again by looking for symmetry, any abnormalities. I'm inspecting his eyebrows and eyelashes for symmetry. They both look symmetric. Also I'm looking at his palpebral fissure to make sure it looks the right distance, which it is, which is from the distance between the eye to eye, and it's even. Now I'm gonna use the Snellen eye chart. So Nico, you can stand up. All right, cover your left eye. Cover your left eye with your hand, and read this top line.
A, C, D, O, Z.
Yep. Cover your right eye, and read this top line.
A, C, D, O, Z.
Perfect. All right, 20/20 vision. All right. I'm also looking at his sclera for color when I look at his eyes. The sclera should be white. The conjunctiva underneath, when I pull down his eyelids, that should be pink and nice. Also, I don't have a pen light, so I can use the phone. I'm gonna do this.
It's gonna hurt.
Nope, you're just gonna look straight forward. Don't look at the light, look straight forward. I'm looking to see if his pupils constrict, and they do. Yep. When I pull the light away, they get bigger. When I pull them closer, they get smaller. And I'm also looking at the corneal light reflex, which is a reflection of the light off the cornea. It should be it should be like a pinpoint white light near the center of the pupil in each eye. Yep, and I see it. Okay. All right, now to check your extraocular muscles, I'll do a test called the cover, uncover test, okay? So you're gonna look at the phone, cover your right eye with your hand, but look at the phone. Ready? So now when he uncovers, I'm gonna see if his eye was fixed on the object on the phone, or if it jumps to fix. It's supposed to be on the phone, right? Uncover, and it was fixed. All right, left eye. Look at the remote or the phone. Take off your left eye. Yep, and they're both fixed, which is the normal thing that's supposed to happen. Now I'm gonna check your visual fields, which is associated with your cranial nerve 2, the optic nerve. I'm gonna check your peripheral vision by putting my hands on the sides of your face. Tell me when you can see my fingers. So look straight ahead, tell me when you can see my fingers, okay?
Yeah.
All right, one more time.
Yeah.
All right, perfect. Now I'm gonna test your cranial nerves 3, the ocular motor, 4, the trochlear, and 6, the abducens, with the 6 different cardinal views. All right, so you're gonna follow my finger. Ready? Keep your head straight and just follow it with your eyes. Good. All right.
I never did that.
You never did that?
Yeah.
All right, now look at me. You're gonna follow my finger as I bring it to the bridge of your nose so I can look for convergence and the constriction of your pupils. Perfect. All right. So that's the end of the eyes. I'm gonna head over to the ears now. So I'm gonna start by looking at the placement of the ears, making sure that they're symmetric, there's no redness, no swelling, inflammation, all that stuff. And then I'm gonna pull on the pinna. Any bad feeling, any pain?
Itches.
It itches. I'm also gonna make sure that there's no inflammation, because that could be a sign of infection of the internal canal. All right, so now it's the end of the ears, now the nose. So looking at the nose, again, you want to start by looking at the outside, looking for symmetric, any issues with it. I'm also going to look at the patency of the nostrils, which means the opening of the nostrils. His nostrils are open and clear, they're not occluded, so that's always a good sign as well. All right, so now I'm going to go into his mouth. First, again, look on the outside of the mouth for any symmetry. Keep your mouth closed for a second. Symmetric, any cracks, any bleeding, any lesions, anything really, any mouth sores. I'm also going to look at the lips and the buccal mucosa for red or pink. It's usually like a pinkish color. I'm also going to make sure the teeth and gums over mouth are nice and clean. There's no canker sores. There's nothing around them. Teeth are intact. And then also, there's no signs of decay. So stick out your tongue. Right, his tongue is pink. That's normal. It's pink and moist. It should never be dry. The tonsils, when I look in the back of the throat, when I use his light, say ah. His tonsils are 1+ size. They're pretty small. They're normal size, which is good. Now I'm going to test cranial nerve 9, which is the glossopharyngeal, and the 10th cranial nerve, which is the vagus, by your ability to swallow and the soft palate movements in your mouth. All right, so Nico, can you swallow? Good job. Now I'm going to use my light source, and you're going to say ah when I look at your soft palates. Right? So say ah. Yep, and they're all moving, which is perfect. They're intact. Now I'm going to test cranial nerve 12, which is the hypoglossal. Stick out your tongue. Go, yep, and the tongue's midline. If it was shifted to the left side, we would know there was a left brain injury. If it was shifted to the right side, we know there was a right brain injury. But it's straight in the middle, perfectly fine. You can close your mouth.
Okay.
All right. Now I'm onto the neck. I'm checking the neck for symmetry, lesions, pulsations, lumps, and I'm also making sure that the trachea right here is centered. You can do this by displacing it to the left, displacing it to the right. It's straight in the middle and it's perfectly symmetric. Now I'm going to palpate all the cervical lymph nodes, which are the lymph nodes in your head. So you can start going around, submandibular. You want to be able to feel subauricle. Yeah, all right. Now I'll take his carotid pulse for 30 seconds and multiply it by 2. All right, ready? All right. All right, look straight. Okay. Right, and it was 38, so multiplied by 2 is 76 beats per minute.
Still go.
Okay, thank you. So now it's not indicated to take his jugular venous pressure, so I will not do that. Also, I'm going to check his range of motion and his muscle strength. That goes along with the cranial nerve 11, the spinal accessory. I'll test this by placing my hands on his shoulders and him shrugging his shoulders up and down. So stand up, please. I'm going to place my hands here. You're going to shrug your shoulders up and down, okay? Down, up, down, up, down. Perfect. Now also I'm going to place my hand on their chin, have them move their head around my force. So again, but this time I'm going to be on your chin. Turn to your right. Nope,
Wait, no.
to the right. Good. Turn to your left. All right, and look down. Perfect. All right.
Oh wait, no, my neck. Like a number and neck source.
All right. That concludes the head and neck exam. So now for our last two, we have the neuromusculoskeletal assessment. So I'm going to have you walk across the room normally to the phone and back. I'm watching his gait again, balance everything, making sure everything's in motion. He's perfectly fine. Perfect. Now you got to walk from heel to toe, like normal walking, heel to toe. No, heel to toe. So heel to toe, heel to toe. Yep, go heel to toe, heel to toe. You can put your toes down, Neeks.
Okay.
There you go. All right, and then come all the way back. It's like normal walking. All right. Now I need you to walk on your heels there and back.
Like this.
Now I'm watching if he's steady, if he's shaky, if he's gonna fall. No, those are your toes, your heels, Neeks. Walk on your heels, it's hard. Like this, look at me, ready? Like this. Put your heels down.
Okay.
Walk on your heels. Right, there and back. It's hard. There you go. I'm watching if his rigidity, if he's stiff, if he's able to do it without falling. All the way back, you're almost done. Oh my God, okay. He's over dramatic. Okay, now walk on your toes there and back. No, not run, walk. Come on back. All right, stand here. Stand. Ready? Shallow knee bend. I'm gonna have him do a shallow knee bend. Bend to check his range of motion. So you're just gonna bend your knees shallowly. Nope. Feet together. Bend your knees shallowly. Nope, not your butt. Just your knees. There you go. Back up. All right. Now
A little dizzy.
I'm going. You okay?
Yeah.
All right. Now I'm going to have you stand up. And nope, feet together. Come on, you go. This is for my school. And touch your toes.
Wait, touch.
Touch your toes, like your hands to your toes. All right. All right, stand up. Put both palms out with your palms up. Close your eyes. No, just close your eyes, ready? Stand straight without like a... No, straight. Offer tibials. All right. Now, can you stay like this without falling over, or do you feel like you're gonna fall over?
No.
You don't feel like you're gonna fall over? Okay, perfect. Now, I'm going to assess your spine again. So can you stand up and bend your chin to your chest? And now just touch your toes one more time. Perfect. Okay, back up. All right. So now this is the neurological exam. This is sensation testing. So for cranial nerve 5, the trigeminal, I'm going to put my hands on his jaw and have him tighten his jaw and move it from side to side. Ready? Because this has a motor and sensory part to the cranial nerve, so this is the motor part. So I'm going to put it here. Tighten your jaw. Like bite. There you go. Open. Perfect. All right. Now for the sensory, I'm going to further this cranial nerve. I'll use a broken Q-tip, which I don't have, so I'm just going to use paper. And I'm going to tell him, and he has to tell me if I'm using the sharp or the soft part of the Q-tip. So either my finger or a sharp part of this, right? So close your eyes. So tell me if I'm using the paper or my finger, okay?
Paper.
Yeah.
Finger.
Perfect. All right.
Finger.
Now, I'm going to put an object in his hand and he has to tell me what it is, okay? So you're going to close your eyes, put your hands out.
Which hand?
Whatever hand you want. And I got to find something. I'm going to go get it. Hold on, I'm going to grab it.
So, oh no.
Alright, close your eyes.
I don't know what it is.
Close your eyes. I'm using this.
God.
What do you think it is?
Orange.
Yeah, good job. Alright, now I gotta find some. Alright, left hand.
Okay.
This is a hard one.
Is it the
Okay.
doctor's?
I'll give you a hint. It's one of Scarlett's toys.
French fries.
Oh yeah, you're good. Alright.
I love doing that.
Alright. Now I'm gonna write a number in your palm. You have to tell me what number it is, okay?
Okay.
Close your eyes.
3?
Yeah.
1?
Yep. Alright. Give me this hand.
7?
Mm-hmm.
8.
Perfect. All right. Now I will touch your arms and have you tell me which arm I'm touching or both. So you're gonna close your eyes, put your arms straight out, and I'm gonna touch either one or both, and you gotta tell me which ones I'm touching. Okay?
Left. Left. Right.
Which one am I
Both.
touching? Yep.
Right. Both.
Perfect. All right. Now. Oh, okay. I'm gonna do the same thing with his legs and feet. Ready? Tell me which ones I'm touching. Put them down on the ground.
Okay.
Ready?
Right. Left. Both.
Perfect.
Right.
All right. Now I'm going to test his cerebral function by having him touch his finger to his nose, then to my finger as I move my finger around his peripheral vision. Ready? So sit up. All right. So you can sit on the couch. No, you can sit on the couch. Keep your eyes open. So you're going to touch your nose to my finger, right? And try not to move just your eyes, okay? Just move your eyes with your, remember to touch your nose.
Yeah.
Perfect. All right.
Now
Now I'm gonna have you lay down. You're gonna lay down on here.
Yeah, lay down.
All right, and this is for range of motion, but usually just coordination. You're gonna take your right heel and slide it down your left shin, like this. Slide it down. So take your right heel, slide it down your right shin. Nope, down your right shin. So you're gonna take it on your shin, slide it down.
Okay.
I'm looking for smoothness and not breaking up between the movements. Okay, now do it with your left foot. He demonstrates a very smooth technique. Perfect. Okay. Now I will test your position sense. So I'm gonna have you stand up. I'm gonna have you stand up. Put your hands out and close your eyes. So what I'm gonna do is I'm gonna take your finger. I'm gonna move it up or down. You're gonna tell me if I'm moving it up or down. Okay.
Okay.
Ready?
Up. Down. Down. Up.
Perfect.
Middle.
All right. Now, I'll also do the Babinski reflex. I'm going to stroke the sole of his foot. Usually the natural reflex is like a downward flexion of the toes toward the source of the stimulus. So we'll see. Put your legs up. Ready?
What am I supposed to say?
No.
It tickles.
It tickles? So move towards. There you go. Now you dorsiflex his foot. All right. Now, point localization. I will touch the patient. He has to open his eyes and then point to where he was touched. So close your eyes. I'm gonna touch you somewhere. Then you're gonna open your eyes and you're gonna show me where I touched you. Okay? Open your eyes. Show me where I touched you. Good. Close your eyes. Show me where I touched you.
Belly.
Yep, perfect. All right. Almost done. All right. Neuro. So I also want to mention for the cranial nerves, one, the olfactory. This you can do by having them close their eyes and then you put something by each nostril after you occlude the nostril and then they'll smell it. So say I had the orange and and I occluded this nostril and opened it and put it here and he smelled orange, then that'd be positive and it'd be working and everything.
Can I just smell it?
Also, yes, we have 3 more. Also, the facial nerve is that you can test by them sitting up. All right, smile, frown, puff out your cheeks. Like, there you go. All right, and then the acoustic, the 8th optic nerve, you can do with the whisper test. All right, so I'm gonna occlude your ear. I'm gonna whisper something. You have to tell me what I whispered, okay?
Copy.
No. Ready?
Apple.
We'll try this
I
one.
can hear it on. I'm gonna hear it on baseball.
Okay. And then that concludes my assessment, the
I heard you say
head, eye, ear, nose, and throat, the neuro, and then the musculoskeletal. Thank you,
I
Nico.
heard you say coffee.